I am Amit Bajoria from Siliguri, West Bengal. I was bedridden for almost 8 months, more than 8 months. I had a severe pain in my back. I couldn't even move from one side to other side, not even to go to washroom and all, not even eat my food myself. So at last my cousin, they all advised me to push on to Hyderabad to contact such and such Dr. Mr.Alok Ranjan. So I came to Apollo. I had an appointment with Dr.Alok Ranjan. He has given us an appointment, so good of him. So after the appointment, for a few days I had operated out here. Now I am fully perfect. After 2 months I will be going to home back. In fact, my daughter is out there. My dad, mom, they are waiting for me. They are very happy that on Sunday, on 20th of this Sunday, I am going back to Siliguri. And the most helpful part in my life was my wife. She supported me all the whole way from Siliguri till Hyderabad. I am thankful to God that I got a lovely wife and a lovely doctor also. Now I am feeling very much perfect. I can walk myself. I can go to washroom. I can have my dinner, my lunch myself. Sunday we are flying to Siliguri. I don't need anyone else. My dad, he said, should I send my brother to pick me up from here? I said no. I'll carry my wife to Siliguri now. Previously she carried me. Now I am carrying her to Siliguri back.
My name is Rinku Bajoria. I am from West Bengal. I came with my husband out here for treatment. Like from the starting of this year, he was having severe pain, but in Bengal there was no proper treatment. It means we could not detect what was his problem. We used to give him painkillers, and so much of suffering I had from the 8 months I couldn't say. But somehow some of my cousins, they said to go to Hyderabad. We came out here and we met Dr. Alok. That was too difficult for me because I didn't had any appointment. So early in the morning I came out here. I requested the assistant and he gave me the appointment. Same day he said me to shift out here. Next day we were shifted, and after 3 to 4 days the operation was done. If you would have seen the person before the surgery, you wouldn't imagine what pain he was suffering. He was unable, he never allowed a person to touch. Whatever he used to do, always crying and crying, no painkillers, nothing. But today I am very thankful to God and especially Dr. Alok Ranjan that he made me so happy that today I can't stop my smile. After 2 days I am taking my husband back home, and just it is because of Alok Ranjan sir. Almost all the support I can say I got from him. Whatever problem I had, I used to come to him. Every day I used to come to him with my problems, and every day he was the person to solve my problems. Even I thought that I had 1.5 month antibiotics, how it will be possible for me, but he made it possible. He talked with the doctor, with the therapist. He used to help me the most he can. So I'll say that I have never seen a doctor like Alok Ranjan, the best doctor in my life.
Amit is a young man of 40 years age who came to me in August with extreme back pain, unable to move even a centimeter. When we investigated, he was a case of chronic hepatic disease with infective spondylodiscitis of lower lumbar spine. In other words, he had infection in the spine, which has been going on for at least 7 to 8 months prior to him coming here. No wonder he was in such an extreme pain. The bones were destroyed, infection had spread in surrounding area. He was not even able to eat properly. His nutrition stage was very poor. He was a thin, sticky person who had lost all hope. His family had lost all hope. Chronic illness can not only be draining on your pocket, but more than that, it is emotionally draining. The patient suffers, but more than the patients, the relatives, and especially the closest caregiver suffers a lot. They have to think of everything, including finance, including the outcome, probability of bad result, signing documents where you are explained your recovery in terms of percentages. They're all very draining movement for relatives. He was blessed with a caregiver who always smiled. Even in the worst of the time, I have never seen her crying more than 30 seconds. She always smiled. It is always good to see a devoted caregiver who can, because in chronic illness it's going to be a long time before you will have some good headwind towards you. We operated on him. In the beginning, the extreme pain made the patient very uncooperative, but slowly, he started believing in himself. And actually in last 1 month, he worked very hard in our rehabilitation center, to the extent that the man who was not able to walk for almost 9 to 10 months is just using a walker because his muscles are not strong enough as yet. And hopefully in a couple of months' time, he will not require any assistance, manual or relative. In a chronic disease, there are so many imponderables. To give courage to the patient, caregiver, to look for a better life is not an easy decision for anyone. And you also need a center which can provide you the comprehensive care. It is not only about an operation and about some costly antibiotics, but it requires rehabilitation and a lot of emotional support. I think we are blessed to have a hospital system here where we truly feel that it is not only about an operation and an admission and a discharge. As I always say, that patient should become your family at the end of the care. And that is the greatest thing you can give to the patient.